They faced danger on screen every day. Yet their real tragedy happened in a room filled with doctors and bright lights. These are Hollywood's most heartbreaking surgical deaths. Today, we're counting down the 9 Golden Age stars who died during surgery, revealing what really happened in their final hours and why their deaths still haunt Hollywood to this day. 9. Jeff Chandler, the star taken by a preventable mistake. Jeff Chandler was the kind of Hollywood leading man who looked unbreakable, tall, broad-shouldered, with unmistakable silver hair and a voice that carried authority. He was the kind of actor audiences trusted. On screen, he survived gunfights, battles, and impossible odds. But in real life, he would lose a battle he never saw coming, a routine surgery that turned into a nightmare. In 1961, Chandler injured his back while playing baseball, a simple accident anyone could have. When medication and rest didn't work, doctors recommended back surgery to repair what they believed was a herniated disc. It was a standard procedure thousands of people survived every year. For a healthy 42-year-old, there was no reason to expect danger, but during the operation, everything went wrong. A surgeon accidentally cut an artery, causing massive internal bleeding. Medical historian Dr. Robert Stevens explained that it was not a freak complication. It was a preventable error, the kind that comes down to technique and precision. Although doctors stopped the initial bleeding, the damage had already set off a chain reaction. Chandler's body became vulnerable to infection and organ stress. Fans saw the strong hero who always won, but fame didn't save him. The man who survived everything on screen died because someone slipped during a routine procedure. 8. Joan Crawford, a legendary star surrounded by rumors until the end. Joan Crawford built her legacy on discipline, glamour, and an iron grip over her public image. No one in Hollywood fought aging harder than she did. She slept with ice packs on her face, maintained strict skincare rituals, and controlled every angle of lighting on set. For decades, she refused to let time win. So when she died unexpectedly in 1977, rumors sprang up immediately. Whispers that she had died not from a heart attack, as the official record stated, but during a secret cosmetic procedure performed at home. There has never been proof, but the story refuses to die. Crawford's obsession with preserving her youth was legendary. Biographers said she would endure any pain, try any treatment, and risk anything to maintain her iconic look. So, the idea that she may have undergone a private, unauthorized procedure, one meant to erase age from her face, doesn't sound impossible. 7. Jane Russell, the Hollywood bombshell who outlived the spotlight. Jane Russell was one of Hollywood's great beauties, the curvy brunette whose figure caused controversy, headlines, and even a specially engineered bra. Unlike many stars of her era, Russell lived a long life. She made it to 89, long after fame had moved on. Her death wasn't scandalous or dramatic. It wasn't the result of dangerous beauty enhancements or reckless decisions. It was something far more common, the unavoidable risks of surgery in old age. Russell had lung issues later in life. As her breathing worsened, doctors recommended surgery. It was necessary, not cosmetic. She underwent the procedure, and the operation itself succeeded, but recovery was too hard on her aging body. Complications quickly set in: respiratory failure, weakened immune response, difficulty recovering from anesthesia. These risks grow significantly for anyone in their late 80s. She passed away just days after her surgery. 6. Barbara Payton, a failed surgery at the end of a tragic spiral. Barbara Payton's Hollywood story is one of the darkest and saddest in film history. She was once a rising star, beautiful, charismatic, full of promise, but Hollywood discarded her quickly, and her fall from fame became brutal. After scandals, alcoholism, and poverty, Payton's life collapsed. By the time she reached her late 30s, years of substance abuse had damaged her body and her appearance. Some say she became desperate to restore the beauty that had once made her valuable to the studios that abandoned her. Payton officially died in 1967 from heart and liver failure, but those close to her claimed something more tragic, that she collapsed during a reconstructive surgery meant to rebuild her face. If the story is true, the surgery was her last attempt to reclaim the beauty that once opened doors for her. Her weakened body, ravaged by years of alcohol and drugs, simply couldn't handle the stress of anesthesia. 5. Ramon Navarro. A brutal attack followed by impossible surgery. Ramon Navarro was one of the great stars of the silent film era, handsome, elegant, and effortlessly charismatic. Audiences adored him in Ben-Hur and other epics. He was the kind of actor who seemed untouchable. But in 1968, Navarro's life ended in one of Hollywood's most horrifying crimes. Two brothers, looking for money, broke into his home. Rumors had spread that Navarro kept cash hidden in his house, a lie that would cost him his life. They tortured him for hours, inflicting horrific injuries. By the time help arrived the next day, Navarro had suffered severe internal damage, head trauma, and asphyxiation injuries. Doctors rushed him into emergency surgery. They tried everything: stopping internal bleeding, repairing damage, stabilizing his breathing. But the injuries were too severe, and too much time had passed. No amount of medical skill could undo the violence he had endured. Navarro died soon after, not because doctors failed him, but because his body was broken beyond repair. The image, a heroic leading man adored worldwide. The reality, a victim of a brutal crime whose injuries were too severe for modern medicine to save him. 4. Marie McDonald, the star. Known as The Body and a Death Wrapped in Mystery, Marie McDonald was one of Hollywood's classic beauties. So striking that the studio didn't bother giving her a dramatic nickname. They simply called her The Body. Her career wasn't built on powerful acting or iconic roles. It was built almost entirely on her looks. That kind of attention might feel flattering at first, but it often leads to a heavy burden: the pressure to stay perfect. McDonald lived under that pressure her entire career, and even after her fame faded, the obsession followed her. By the 1960s, her career had stalled, her personal life was collapsing, and she struggled with substance abuse and emotional instability. Still, the need to stay beautiful never left her. When she died in 1965 at just 42 years old, the official cause was listed as a drug overdose. But almost immediately, rumors began swirling, dark whispers that she had actually died during a cosmetic procedure. Some said she was undergoing plastic surgery to revive her fading beauty. Others believed she was receiving injections or treatments outside a medical environment. And then there were the rumors that her body was moved afterward to make the overdose look believable. Nothing was ever proven, but the mystery is telling. Marie McDonald built her career on beauty. She lived for it, was marketed for it, and was destroyed by it. Whether she died from an overdose or on a table trying to preserve that beauty, the result is the same. Hollywood's obsession with perfection followed her to her final moments. 3. Eddie Fisher, the heartthrob whose final curtain fell in a hospital room. Eddie Fisher wasn't a movie star first. He was a voice. During the 1950s, he was one of America's most beloved singers, delivering romantic ballads that won him millions of fans. His personal life made even bigger headlines. His marriages to Debbie Reynolds and Elizabeth Taylor created one of the biggest scandals Hollywood had ever seen. But despite all the drama, Fisher lived a long life, and when he died at age 82, it wasn't from scandal, addiction, or danger. It was something far more common and far more human. Fisher underwent hip surgery, a routine procedure for people his age. The operation went as planned, but like many elderly patients, he struggled during recovery. Post-surgery complications, the kind that quietly threatens seniors every day, began to build. His body, weakened by age, couldn't fight them off. Modern medicine can perform miracles, but age changes the rules. Even a simple surgery becomes a risk when the body is fragile. Fisher, the man whose voice once filled concert halls, slipped away after what should have been routine medical care. His death wasn't scandalous or mysterious. It was the same quiet medical reality faced by millions around the world. 2. Constance Bennett, the screen sophisticate lost to a rare medical disaster. Constance Bennett was a vision of elegance during Hollywood's golden era, with perfect diction, poise, and effortless sophistication, she became one of the highest-paid actresses of the early 1930s. She looked untouchable, calm, graceful, completely in control, but her death was something she could never control. At 60 years old, Bennett went in for a routine dental procedure, something simple, something millions of people undergo every year. But during the appointment, something went terribly wrong. Without warning, she suffered a cerebral hemorrhage, an unexpected, catastrophic event where a blood vessel in the brain bursts. It wasn't caused by the dental procedure, it wasn't caused by an error, it was random chance, one of those rare but devastating medical events that can strike anyone, anywhere. Doctors rushed her into emergency surgery, fighting to relieve the pressure on her brain and stop the bleeding. Despite their efforts, the damage was too severe. Constance Bennett died on the operating table. Her life ended not by recklessness or risk, but by tragic timing. Her death highlights an uncomfortable truth. Even with money, fame, and top-tier medical care, some medical events simply cannot be predicted or prevented. 1. Jean Harlow, Hollywood's first blonde bombshell, lost to delayed medical action. Jean Harlow wasn't just a star, she was a revolution. With her platinum hair, electric screen presence, and sharp comedic timing, she helped define the modern image of the blonde bombshell. Audiences adored her. MGM protected her like a precious jewel. She was 26, famous, beautiful, and unstoppable. But behind the glamour, her body was failing, and no one realized it until it was too late. In 1937, Harlow began experiencing severe symptoms: fatigue, swelling, nausea, abdominal pain. Doctors misdiagnosed her condition as a simple infection or flu. In reality, her kidneys were shutting down, slowly poisoning her body from the inside. For weeks, she suffered without proper treatment. By the time doctors recognized the severity of her condition, her kidneys were failing completely. She was rushed to the hospital. Emergency surgery was prepared. But 1930s medicine didn't have dialysis, antibiotics, or the tools needed to save a patient in full renal failure. As doctors prepared to operate, Harlow deteriorated rapidly. She lost consciousness before the surgery could begin. She never woke up. Her death shocked the world. How could a woman so young, so healthy-looking, so famous, die so suddenly? The answer was a tragic combination of misdiagnosis, medical limitations of the era, and the belief that Hollywood stars were too important to get seriously ill. Today, kidney infections are treatable. With early diagnosis and modern medicine, Jean Harlow likely would have survived. But in 1937, Hollywood's first blonde bombshell became one of its greatest tragedies.